This segment is sponsored by Buckeye Health Plan.
Did you know that 30% of Ohio adults have been diagnosed with high blood pressure during their lifetime? Well, during High Blood Pressure Education Month, we're here with Dr. Kambelos, Medical Director for Buckeye Health Plan, to discuss the impacts of high blood pressure on our short and even long-term health. Dr. Kambelos, thank you so much for joining us today.
Happy to be with you, Cam.
So why focus on this, the need to manage high blood pressure from the perspective of Buckeye Health Plan?
Okay. Well, our goal, our purpose at Buckeye Health Plan is to improve the health of the community, one person at a time. And we sincerely mean that. We care about our members, and I'm pleased to be a part of that team. High blood pressure is an extremely common diagnosis, medical diagnosis. And left untreated, undiagnosed, it can lead to a variety of really serious health problems. So we have the opportunity to intervene. 35% of Medicaid members are postulated to have high blood pressure or hypertension. 60% of older adults, 40% of African Americans, and 40% of men. So those are significant numbers.
So let's dig in a little bit deeper. Maybe for people that don't know, what is high blood pressure?
Okay, so high blood pressure, also known as hypertension, is an increased pressure in our arterial tree, or the increase of blood flow, if you will.
Okay.
What that does over time, it erodes or injures the inner lining of our blood vessels, and that can lead to an increased risk of stroke, heart attack, or perhaps even other more serious, very serious organ damage, such as kidney disease and eye problems. So as you can see, we have the opportunity to intervene here. As far as what perhaps we can do, I think getting screened early, getting screened periodically, screening yourself by checking your blood pressure readings at home periodically.
Is that how you know if you have it? Because that's a big thing too. People might not know that they have high blood pressure.
And that is one way to know.
Yeah.
Unfortunately, there are great numbers of people who have no idea they have high blood pressure, perhaps even 1 out of 5. Now, some of the common symptoms could be, but are not always present, problems with the eyesight, headaches, nosebleeds, chest discomfort, trouble breathing, swelling of the legs. However, once again, many people do not know, do not get screened, and our advice is to get checked and supplement that, with your own home blood pressure monitoring.
So is it preventable, and then is it treatable? Those would be my next questions.
Well, in some cases it can be preventable. It is treatable. Where there are not structural or genetic factors, or perhaps in combination, there are several things, lifestyle interventions, that one can implement in order to reduce the chances of developing hypertension. Some of these are dietary in nature, reducing caffeine, reducing salt intake, avoiding excessive alcohol consumption. Those who smoke should avoid using tobacco products. Those of us who are overweight should try to lose weight. We should exercise 30 minutes most days of the week, and of course take overall better care of ourselves. But we can make those lifestyle interventions and reduce the chances of developing hypertension.
And the best part is to be informed, and that's exactly what Buckeye Health Plan is doing. So thank you. I like to think of this as a sign for a lot of people. Maybe they didn't know they have it, or they've been questioning it. The first thing they should do is go get it checked, correct?
Absolutely. Go see your primary care physician, and if you don't have one, establish a long-term relationship one. And once again, supplement with your own readings. That'll supplement that health care.
Perfect. Dr. Kambelos, thank you so much for joining us and sharing this with our viewers.
Thank you.
Like he said, to learn more about high blood pressure, all you have to do is visit BuckeyeHealthPlan.com/heart. We'll be right back.